We have the largest sample now, over 15,000 people, which is an incredibly large sample. And when we started on the 22nd, we had 2,900 people surveyed at that time. We had about a 13.9%, just about 14% infection rate statewide. It then went up to about 14.9, and today it is down to 12.3. This is outside the margin of error, so this is a good sign. And it is 15,000 people surveyed, so it's a large number. You can then start to look at where in the state, who in this state, so that will inform our strategy. You can see it's a little bit more male than female. Not exactly sure why that is. In New York City, you see the number went from 21 to 24, and it's down to 19.9. So again, that's a good sign. You will always want to see the number dropping rather than the number increasing. Within New York City, you see the Bronx is high, 27%, Brooklyn 19, Manhattan 17, Queens 18, Staten Island 19. And we're going to do more research to understand what's going on there. Why is the Bronx higher than the other boroughs? Statewide, you see it's basically about flat. This is predominantly an issue for New York City, then Long Island, then the northern suburbs, then the rest of the state. But Erie County, which is Buffalo, New York, has been problematic. The racial breakdown we're looking at to see study disproportionate impact, who is paying the highest price for this virus, what's happening with poorer communities, what's happening in with the racial demographics, and also if there's any information in different ages that could be instructive. We're still getting about 900 new infections every day walking into the hospital. That is still an unacceptably high rate. We're trying to understand exactly why that is. Who are those 900? Where is it coming from? What can we do? Getting more information on where these new cases are coming from. Where do you live? Not just borough, but what community within the borough? Are there different health factors that are affecting the new infection rate, comorbidities? How are they traveling? Are they in their cars? Are they on public transportation? Is it the New York City transit system, Long Island Railroad, et cetera? So we asked the hospitals to collect that data yesterday. We'll be getting that over the next couple of days, and that will help us again get more information. In the meantime, we know that vulnerable populations are paying the highest price, our seniors, our nursing homes, and our poorer communities. They are the ones where you have higher infection rates and you have higher risk and higher exposure. We're going to distribute today 7 million masks to just those communities in nursing homes, poorer communities, people in public housing in New York City Housing Authority. So we'll be doing that today. 7 million masks is a large number. There's about 9 million people in New York City total. So 7 million masks is obviously will make a big difference.